Now we're going to start the discussion about the arteries of lower limb. See, arteries of lower limb again, a very vague and dry topic only. Very rarely we get questions from the arteries of lower limb. Again, we're going to discuss this topic. Yes, for PG entrance exam. In that perspective only, we're going to discuss. So the things required for arteries of lower limb for the PG entrance exam. Okay, so we have to know this flow chart. First, we write this flow chart and then we continue. Now the point is, first the external iliac artery. External iliac artery. Okay, so external iliac artery, yes, is the branch of common iliac. Aorta, abdominal aorta bifurcate at the level of L4 into two common iliac, right and left common iliac artery. Now each common iliac artery divided into external iliac artery and internal iliac artery. Okay, now the external iliac artery, which in turn continue as femoral artery from the midinguinal point. So from midinguinal point, the external iliac artery, which in turn continue as the femoral artery. Then the femoral artery, which pass below the inguinal ligament, and enters the thigh. Now in the thigh, the femoral artery is enclosed by femoral sheath, in which compartment? Very good, in the lateral compartment. So again, the femoral artery, by presenting inside the femoral sheath, that compartment, it also become the content of one triangle. What triangle? Femoral triangle. Yes, very good. And then below the femoral triangle, we know we have a canal. What canal? Adductor canal. So now then the femoral artery, which passes through adductor canal. I told you in the adductor canal, the relationship of the femoral artery and the femoral vein will change. In the femoral triangle, I told you femoral artery is passing in the lateral compartment of the femoral sheath. Femoral artery is lateral to femoral vein. Now in the adductor canal, the femoral artery is anterior to femoral vein. That is very important. The relation will change in the adductor canal. So in the adductor canal, the femoral artery is anterior to femoral vein. And then the artery passes through adductor hiatus. Adductor hiatus is the opening in the adductor magnus muscle. Now by passing through adductor hiatus, then the artery enters popliteal fossa. And the name of the artery changed to popliteal artery. So artery passes through popliteal fossa and the name of the artery changed to popliteal artery. Okay? Yes. Now the popliteal artery at the lower border of popliteus muscle, which is divided into anterior tibial artery and posterior tibial artery. Okay. Now anterior tibial artery, which passes above the interosseous membrane and enters the anterior compartment of leg. Anterior tibial artery. Okay. So anterior tibial artery passing above the interosseous membrane and enters the anterior compartment of leg. And anterior tibial artery, it is artery for anterior compartment of leg. Okay. Yes. Now the anterior tibial artery at the junction between medial and lateral malleolus. At the junction between the medial and lateral malleolus, which in turn continue as dorsalis pedis artery. Okay. So dorsalis pedis artery is nothing but continuation of anterior tibial artery at the junction of two malleolus. Then the dorsalis pedis artery enters the sole. How, sir? Through the gap between the first dorsal interosseous. And in the sole, dorsalis pedis artery, which joins with lateral plantar artery, joins with lateral plantar artery to form plantar arch, to form plantar arch. Okay, so dorsalis pedis artery enters the sole through the gap between the heads of first dorsal interosseous, and in the sole, dorsalis pedis is joining with lateral plantar artery to form plantar arch. Clear? Now come to the posterior tibial artery. Now posterior tibial artery, it is artery for posterior tibial artery, it is artery for the posterior compartment of leg. And please remember, posterior tibial artery, it is the artery which is giving nutrient branch to tibia, which is giving nutrient branch to tibia. And the posterior tibial artery, which gives peroneal artery. Posterior tibial artery is giving peroneal artery. Peroneal artery, it is artery for lateral compartment of leg. Okay, so artery for anterior compartment of leg, anterior tibial artery. Posterior compartment of leg, posterior tibial artery. Lateral compartment of leg, peroneal artery. Peroneal artery is a branch of posterior tibial artery. Very good. Now the posterior tibial artery, which enters the sole, enters the sole. How, sir? I told you, by passing below the flexor retinaculum of the leg. And in the sole, which is divided into lateral plantar artery, in the sole, divided into lateral plantar artery and medial plantar artery. And this lateral plantar artery joining with dorsalis pedis artery to form plantar arch. Just now I told you. Okay. Yes, this is the schema of the arteries of the lower limb. Okay. So femoral artery passes through adductor hiatus, enters a popliteal fossa, continuous popliteal artery. The popliteal artery at the lower border of popliteus muscle divided into anterior tibial artery and the posterior tibial artery. Anterior tibial artery continuous, dorsalis pedis artery enters the sole and joining with lateral plantar artery to form plantar arch. Lateral plantar artery, medial plantar artery branches from posterior tibial artery. Okay, posterior tibial artery is artery for posterior compartment of leg. Now what is a branch? Now the nutrient branch to tibia is given by posterior tibial artery. Now what is artery for lateral compartment of leg? Peroneal artery. Peroneal artery is a branch of posterior tibial artery. Very good. These are the points you have to know about the arteries of lower limb. Now we see diagram and we see some applied. Okay. Now this is the femoral artery. Yes, very good. Now femoral artery, yes, we are seeing the branches of femoral artery. Again, try to know this branch name, that is enough. And no need to know any other extra points. So try to remember the branch name. Okay. Now branches from femoral artery. Number 1, superficial epigastric artery. Number 1. Number 2, superficial circumflex iliac artery. Number 2. Number 3, superficial external pudendal artery. And number 4, deep external pudendal artery. Okay, superficial epigastric, superficial circumflex iliac, superficial external pudendal, and deep external pudendal. Okay, and the femoral artery also gives profunda femoris artery. And before passing through adductor opening, the femoral artery also gives descending genicular artery. Okay, now these are the branches of femoral artery. Yes, superficial epigastric, superficial circumflex iliac, superficial external pudendal, deep external pudendal, profunda femoris, and descending genicular. Try to know the branches name, that is enough. Now we're going to see in detail about the profunda femoris artery. Now the profunda femoris artery gives 3 branches. What are those? Medial circumflex femoral, lateral circumflex femoral, and 4 perforating arteries. 4 perforating arteries. Okay, again name itself you have a clue. They perforate which muscle? Adductor magnus muscle. So yes, now these are the perforating arteries. So we have 4 perforating arteries. Now these perforating arteries, I told you already, it perforates one muscle. Which muscle? Adductor magnus muscle, and goes to back of thigh. Perforating arteries, after piercing the adductor magnus muscle, which goes to back of thigh. The 4 perforating arteries perforate adductor magnus muscle and goes to back of thigh. Clear? And in the back of thigh, each one divided into ascending branch and the descending branch, and the anastomose with each other. The point is, the ascending branch from the first perforating artery which takes part in cruciate anastomosis, the ascending branch from first perforating artery, which takes part in cruciate anastomosis. Cruciate anastomosis. The ascending branch on the first perforating artery, which takes part in cruciate anastomosis, and last one, the descending branch from the fourth perforating artery, which takes part in genicular anastomosis. Genicular anastomosis. Okay. Now, I told you we have 4 perforating arteries. In that, the second perforating artery gives the nutrient branch to femur. So, nutrient branch to femur is coming from the second perforating artery. Okay. Nutrient branch to tibia, I told you. Which artery? Posterior tibial artery. Yes, don't forget. Next one. We have anastomosis around the hip joint. We have 2 anastomosis. Trochanteric anastomosis and cruciate anastomosis. Now, these anastomosis are between internal iliac artery and external iliac artery. Internal and external iliac arteries. Okay. Now, what are the arteries involved in trochanteric anastomosis? In trochanteric anastomosis, 4 arteries are involved. What are those? Superior gluteal artery, inferior gluteal artery, branch from medial circumflex femoral and lateral circumflex femoral. Medial circumflex femoral, lateral circumflex femoral, they are the branches of profunda femoris artery. Okay. Now, superior gluteal artery is a branch of. Please recall what I told you in the pelvis perineum topic. I told one mnemonic also for this. Silk branch. S-I-L-K. Silk branch. Yes, please don't forget silk. Now, superior gluteal artery is a branch of. Very good. Posterior division of internal iliac artery. Very good. What about inferior gluteal artery? Anterior division. Only 3 branches from posterior division. Mnemonic silk branch. Superior gluteal, iliolumbar and lateral sacral. Very good. Anterior division of internal iliac artery. Now, medial circumflex femoral, lateral circumflex femoral, branch of profunda femoris. Profunda femoris branch of femoral. Femoral artery is a continuation of external iliac artery. Okay. These are the arteries involved in trochanteric anastomosis. Next, we have cruciate anastomosis. Cruciate means you know the meaning, cross. Now, what are the arteries involved in cruciate anastomosis? 4 arteries. What are those? These arteries are inferior gluteal artery, and the first perforating artery ascending branch, again lateral circumflex femoral and medial circumflex femoral. What are the arteries? So, I will highlight inferior gluteal artery and first perforating artery ascending branch, lateral circumflex femoral and middle circumflex femoral. So, these arteries involved in the cruciate anastomosis. So, these are the arteries involved in trochanteric anastomosis and cruciate anastomosis. Right. Now, next, we're going to see the arteries supplying the femoral head. See, femoral head, it is supplied by medial and lateral circumflex femoral artery. Medial circumflex femoral, lateral circumflex femoral. The femoral head is also supplied by one more artery, that is foveolar artery. See, foveolar artery is a branch of obturator artery. Obturator artery is a branch of, very good, anterior division of internal iliac artery. Anterior division of internal iliac artery. So, obturator artery gives one small contribution to the head of the femur, that is foveolar artery. Okay. Okay. So, now head of the femur is supplied by 3 arteries. Medial circumflex femoral, lateral circumflex femoral and the foveolar artery. Now, what is the main artery supplying the femoral head? Our medial circumflex femoral, that is the best answer. Medial circumflex femoral greater than lateral circumflex femoral. So, femoral head is supplied by medial circumflex femoral greater than lateral circumflex femoral artery. Okay. Now, these 2 circumflex femoral arteries, they form one circle around the femur and they give straight branches. Now, can you see these branches? Now, these branches are called retinacular branches. They are called retinacular branches. Now, these retinacular branches ascending in which part of the femur? Ascending in the neck of the femur, and they supply the femoral head. So, retinacular branches coming from lateral and middle circumflex femoral, they ascending on the femoral neck and they reach the head and they supply the femoral head. Majority of the femoral head is supplied by circumflex femoral artery only. Now, out of the 2 circumflex femoral artery, what is the artery supplying the femoral head? Medial circumflex femoral greater than lateral circumflex femoral. Please don't forget. Okay. So now we're going to see two applied. Number one, fracture of the neck of the femur. The patient is having fracture at the neck of the femur. Now what will happen, sir? Now these retinaculum vessels are damaged. I told you the femoral head is mainly supplied by medial and lateral circumflex femoral artery. If these retinaculum vessels are damaged, now there is no vessels reaching the femoral head. So patient have avascular necrosis of the femoral head. Okay. So please write fracture of neck of the femur. What will happen to the patient? The retinacular vessels are damaged. Retinacular vessels coming from the medial and lateral circumflex femoral artery are damaged, which in turn leads to, yes, avascular necrosis of femoral head. Avascular necrosis of femoral head. Okay, right. Next one. Now we have intertrochanteric fractures. Now the fracture just few centimeters below the neck of the femur. Fracture is along this line, what I drawn there. That is intertrochanteric fractures. That is intertrochanteric fractures. Now the intertrochanteric fracture is just a few centimeters below the neck of the femur. But here in this condition, the retinacular vessels are not damaged. Retinacular vessels are unaffected. So you won't see avascular necrosis of the femoral head. Very important. In the intertrochanteric fractures, very good. The retinacular vessels are not affected. So no avascular necrosis of femoral head. Okay, right. Over. So these are the points I don't know about the blood supply of the femoral head. Now we have two more applies. That is our corona martis. Now corona martis, it is an vascular anastomosis. It is the vascular anastomosis. Between which arteries, sir? Between the inferior epigastric artery, and the obturator artery. Now these two arteries anastomose with each other. Now where is the anastomosis? Now this anastomosis is present just posterior to the ramus of pubis, superior ramus of pubis. Just behind the superior ramus of pubis, pubis bone, you are seeing, and just behind the superior ramus of pubis, this one, superior ramus of pubis. And this anastomosis is present just behind the superior ramus of pubis. And if this anastomosing variant is damaged, then there is a risk of, yes, a severe hemorrhage. Okay, that is why this is very important. That is why it is called corona martis. Okay, right. Now one more applied is the abnormal obturator artery. Now sometimes I told you obturator artery, it is a branch of anterior division of internal iliac artery. Anterior division of internal iliac artery. Okay, sometimes the obturator artery is replaced by the pubic branch from inferior epigastric artery. So the pubic branch from inferior epigastric artery replace the obturator artery, and this artery is called abnormal obturator artery. Why we have to know this, sir? The abnormal obturator artery, which is very close to the medial margin of lacunar ligament, Now lacunar ligament is forming the medial boundary for the femoral ring. So again, the surgeon may damage this surgery while doing the femoral hernia repair. That is why this is very important. Okay. So abnormal obturator artery, which is very close to lacunar ligament. Lacunar ligament is the medial boundary of the femoral ring. So surgeon during the femoral hernia repair mistakenly may damage this artery, abnormal obturator artery, which result in severe hemorrhage, right? Yes, that's all. Now one last diagram about the tibial arteries. Now this is a popliteal artery divided into anterior tibial and the posterior tibial artery. And the posterior tibial artery is giving fibular artery, which pass below the flexure tenaculum and center of the sole divided into lateral and middle plantar artery. Now lateral plantar artery joining with dorsalis pedis artery and form the plantar arch. Okay, Now we're going to see some animations for the blood supply of lower limb. Now this is our femoral artery. So femoral artery is a continuation of, yes, external iliac artery. That is external iliac artery, which in turn continue as a femoral artery. Okay, right. Now the femoral artery is a main branch we see. Now this is a D branch, profunda femoral artery. Now profunda femoral artery gives three branches. Okay. Now medial circumflex femoral, and then lateral circumflex femoral, and some small branches. These are perforating branches. Okay. These are three branches from the, yes, our profunda femoris artery. Now see the opening, that is the adductor hiatus. Now through adductor hiatus, the femoral artery is passing and then come to the back of knee joint, which in turn continue as the popliteal artery. Okay. So now the popliteal artery, after giving small genicular branches at the level of lower border of popliteus muscle, that's a popliteus muscle. The lower border of popliteus muscle, yes, it is giving two terminal branches, posterior tibial artery and anterior tibial artery. Okay. Now the posterior tibial artery, which in turn gives fibular artery. Fibular artery, it is artery for lateral compartment of leg. Posterior tibial artery, it is artery for posterior compartment of leg. Now, after supplying the posterior compartment, the posterior tibial artery, which pass below the flexor retinaculum of the leg. The flexor retinaculum. Now, the posterior tibial artery, which pass below the flexor retinaculum of the leg. Okay. Now, how the arrangement below the flexor retinaculum of the leg? We have a mnemonic: Tom, Dumbledore, and Harry. T, tibialis posterior. D, flexor digitorum longus. A, artery, posterior tibial artery. N, nerve, tibial nerve. And last one, flexor hallucis longus. Arrangement from medial to lateral below the flexor retinaculum of the leg. Now, posterior tibial artery enters the sole and divided into medial plantar artery and lateral plantar artery. Now, this is the anterior compartment of leg. We are seeing the anterior tibial artery. Now, anterior tibial artery, yes, it is the artery for anterior compartment of leg. Now, we're going to remove this retinaculum, extensor retinaculum, and we're going to remove some muscles so that you can see the anterior tibial artery clearly. Okay. Now, yes, anterior tibial artery. Now, anterior tibial artery, which in turn continue as dorsalis pedis artery at the junction of two malleolus. At the junction of two malleolus, anterior tibial artery, which in turn continue as a dorsalis pedis artery. Dorsalis pedis artery gives up branches, arcuate artery and dorsal metatarsal artery, arcuate artery, branch of dorsalis pedis artery, and first dorsal metatarsal artery, this one. Okay. Now, after giving these two branches, dorsalis pedis artery, it is passing through the gap of this muscle. What is the muscle there? Our dorsal interosseous. Now, dorsal interosseous having two heads. Now, dorsalis pedis artery, which is passing through the gap between the heads of dorsal interosseous and then enter the sole. Now, in the sole, dorsalis pedis artery joins with lateral plantar artery and complete the plantar arch. Okay, right. Yes. So these are the points you have to know in the arteries of lower limb.